your little makeshift stand here. Okay. We're live.
Okay, guys, I'm gonna first introduce to you my two items and then tell you a healthcare issue of how I think that they could be involved in a hospital or healthcare setting. First, I have chapstick because the hospital is super dry and a lot of people in ICU or people that are intubated or even healthcare providers get dry skin, chapped lips. So that's how my chapstick incorporates to a healthcare issue. And my second is my Christmas coffee mug because hydration is big, and I know as a healthcare provider or working in the healthcare field myself that caffeine is a big thing because it gives you energy, you're awake. Come on, guys, give me some input of what else coffee could be.
It wakes you up in the morning. It puts you in a better mood. It makes you so you're ready to do chores, do the day.
Get rid of headaches.
The caffeine.
Yeah, it helps with headaches a lot.
That's how my two objects fit into a healthcare issue.
It's easy to get. It's cheap. It's not like an expensive.
It's not illegal.
It's not cocaine. Yeah.
Okay.
I think that's good. Strong word.
Excellent. So, okay, I'll go. So for my two items, I have a notebook for, healthcare providers are constantly having to, chart and document issues with patients and, sorry, just following the course of their treatment. Everything needs to be written down appropriately. And you need something to write it down on, which in this day and age, everything's computerized, but we'll side note that. And I have my shining star, which is representative of just a little gratitude, a little just thank you, like I appreciate you, hard work. A lot of times that's kind of looked over and it's just a, go do your job kind of thing. A thank you goes a long way.
Yeah. Okay, my two items, I have a protein bar because I know if I'm really hungry or if my coworkers are hungry, we definitely don't work together at the best that we could because we're hangry and all that fun stuff. And I think you don't make the wisest decisions while you're hungry, so your thinking could be clouded. And then I have my water bottle because it's important to stay hydrated while you're working and being physical for 8 or 12 hours or however long you work. And like Miranda said, it's super duper dry, especially, well, I know it is at Mercy. I get super thirsty, so it's good to keep hydrated and eat.
Yes.
All right. So for my two items, I have a pen and I have a remote. In my area of healthcare, I think these are really, really important items. A lot of times when you don't have, well, not necessarily the remote, but when you don't have pens, like early in the morning, if a call comes out and we go on a call and we get there and we get our clipboard out and we go to document and we don't have a pen on us. And we, start drawing up meds or start doing cardiac therapy, we don't have anything to document it. And it's a mad scramble to find a pen or something to document with. So it's a real undervalued piece of plastic. The second one, I picked a remote. A lot of times, we do a 24-hour shift, and so you're not doing something the entire 24 hours. So when you have bad, stressful, annoying, whatever interactions with patients, you have a remote, and you can turn on the TV and you can decompress a little and relax and try and move past whatever it was you just had to deal with.
I like it.
I'm not sure what we do after this.
Okay, now I kind of think we need to, which I feel like we sort of did it in a way. Sorry,
What's it say?
I'm like reading as I'm saying this to you guys. I think now it's just like a common presentation as a whole
Mm-hmm.
of, yeah.
Yeah, I get it.
Okay.
So do you think we did that in relatively about 2 minutes? So at least we don't have to shorten it too much?
I think we could, yeah.
Okay.
And I think we could maybe even kind of like combine a few here and there
Mm-hmm.
to kind of make it more presentation-like, if you will.
Yeah. Mm-hmm.
Instead of it being like 4 separate presentations, make it one presentation. Sure.
Mm-hmm.
Okay.
So I have an idea.
Oh my God.
So me and Miranda sort of go together because we're about caffeine and hydration and eating, and then for her chapstick, kind of more of a comfort thing. So we could kind of go together a little bit. And then Adam has his pen and you have the notebook about documentation.
Yeah.
Yeah.
And then your shining star and his TV remote kind of go together because you need to recognize each other and then have downtime.
And kind of do things for yourself.
Yeah.
I think that's
Yes, like after your hard work and, you know, everything that you've gone through to be able to have that,
Yeah.
like you said, that downtime, that kind of like reward for yourself.
Yeah.
Yeah, because like with yours and Miranda's, a lot of issues, a huge thing, especially with like nurses on the floors. One of their biggest complaints and biggest, well, issues in the hospital is that they never get breaks. They never get time to like pee, have lunch, anything.
Mm-hmm.
To have like the caffeine, the protein bar, the water, like easily accessible. They can kind of grab something,
Right.
have a little pick me up, if you will.
So that can be our kind of problem one.
Right.
Is taking care of our nurses or the people, not necessarily nurses, but you get what I'm saying.
healthcare provider.
Right. And then
Exactly.
Right.
That was good.
and then and then our second problem would be documentation, making sure you have the proper materials to document.
Yeah, being
Yeah.
just being prepared as, you know, a healthcare person.
Right. And then our last one can be taking, again, sort of taking, I don't know what to call it, but recognizing your coworkers and you with your shining star for the hard work.
Making sure you take me time.
Right.
Mm-hmm. And then the remote.
Yeah, that you have to, you know, take care of yourself in order to be able to take care of others.
Yeah. Mm-hmm.
Okay. Way to go, team. Okay. So
Are we ready to start the presentation?
Yeah. Me and Miranda, do you want to go first?
yeah, because it said we could do like a little run through before
Yeah.
we would like consider our final presentation.
So this is the run through.
Well, I
Sure.
guess- yeah.
Okay, so our first healthcare issue that we decided upon was about making sure that healthcare staff and even yourself take care of yourself because not everybody always gets time to take a minute out of their day to make sure they're eating, drinking, using the restroom because they're busy taking care of patients and doing all the things in their healthcare work. So Bailey and I went together on a few things that healthcare providers make sure to, or that could be very useful useful in their field, and mine is chapstick and a coffee mug for caffeine. So caffeine can keep you going. Also, patients use chapstick a lot in hospital because it's so dry, and as well as healthcare providers as well. Bailey, introduce her to items.
I have a protein bar, so you always have something in your stomach and you're thinking clearly. When you're hungry, you're grumpy, and that can make teamwork a lot more difficult. And then I also have my water bottle to stay hydrated and making sure you're drinking enough water. And like Miranda said, it can get so dry, and just making sure you're staying hydrated.
Good job.
Awesome. Okay, so Adam and I have our pen and notebook. And
Our pen and our notebook kind of go hand in hand as in the area of documentation, right?
Second healthcare issue is what you guys are talking about now, right?
yes, so the second problem.
I'll go to Mommy's
Yes.
this.
Can you hear her? Sorry.
That's okay.
You guys are all sorry. So I'm sorry.
That's fine.
Okay, so second healthcare topic number 2.
So problem number 2 is we discussed the fact that I have a notebook as representation of documenting, and Adam as well has the pen, which go hand in hand. It's really important that as healthcare providers, when it comes time to actually take care of patients, that you are well prepared in order to document and chart all the things that you're doing for the patient, because that carries over.
Being able to document quickly, accurately, and legibly is going to determine how you treat your patient, how well you can treat your patient too. If you don't have a pen, you're not able to document, you're not going to be sure if you can give a med every 5 minutes. How are you going to know the last time you gave it if you don't have a way of documenting when you gave it last? So that's why you got to have your notebook. That's why you got to have your pen.
Exactly. Because once they're,
Yes. So topic number 3, we decided on how important it is to take care of yourself as a healthcare provider, making sure you take time out for yourself. And what did you guys come up with for your items to incorporate that?
Go ahead, Leah.
Okay, so with in order to be able to properly and better take care of patients, you have to first be able to take care of yourself. And so I had, my shining star, like I said, is representation of just your other employees, your coworkers and your employers, just showing that gratitude and that respect for what you do. And just like a thank you and a good job really goes a long way for you to continue to be able to work hard.
Definitely agree with that. So the remote relating to the problem of kind of
And
taking
make sure
care
you're
of.
showing your items when you're talking about it.
Oh, yeah.
The way this is going to help the issue with healthcare and providers having a good state of mind is this symbolizes that you can take some you time to relax, decompress. It's easy to do. It's quick to do. You don't have to be in a specific area. I mean, it's a TV, it's a common area. It's not something hard to come by. All you got to do is sit down, pick this up, and you can start decompressing and relaxing and getting in a more relaxed state of mind, which is going to help you better treat future patients.
Exactly.
Good. Okay, so I think think that was really good, except for the first one and the last one. I feel like I kind of mentioned them in the same way. So for the first one of me and Bailey with like our self-care items, I guess you could say. How should I say that rather than saying? Because I feel like number 1 and number 3, I kind of said the same thing about taking care of yourself.
So 1 could be like physically taking care of yourself, and then 3 could be mentally taking care of yourself.
Yeah, that's good. Because if you think about it, they really kind of all go hand in hand.
Yeah.
Right. So that's a good point. And I also mentioned how like patients use chapstick and stuff too in point number 1. So I think that differs it a little bit too.
And what I would say about the whole chapstick thing is, obviously nobody's going to die from patients or not patients. Nobody's going to die from chapped lips. But taking the time to go and find the chapstick in the supply closet, bring it all the way to the room, and put it on the patient's lips just so that they have not chapped, bleeding lips, so that when family comes to see them, they don't look terrible.
That's what I meant.
It's not
like as a comfort need.
Yeah, it's not so much as they need this to get better. It's more of a showing that you're a person and you care and you understand that this is your loved one and you don't want to see them looking like they are.
Right. That comfort, compassion level. That's just like even a small little thing like chapstick can really kind of
Go a long way.
Yeah.
All right.
Make you feel better as a healthcare provider and make the patient feel better as, on the receiving end of your compassion.
It humanizes you.
Right. And then we have to like way shorten that.
Was that over 2 minutes?
I think so.
I don't know. Can somebody time it like when we kind of start?
I got a phone.
Okay. I've got Bailey all set up here. Why do I keep calling her Bailey? Because I'm looking at you. That's why. I've got Miranda all set up here. So,
All right.
Thank you. Like you said, we need to be sure and show our items too. Because I'm looking at it like as I'm talking about it.
Yeah.
Reader visual, I think, 'cause that's what it's about.
Right.
Okay, so let me know when everybody's ready so I can start with point 1.
Any marks? Get set. Go.
Okay, so our first healthcare issue that we came up with, including our items, Bailey and I had similar ones, or not similar ones, but ones that go together. So we looked at it as a healthcare provider, you need to take care of yourself physically. So I have chapstick because hospitals and healthcare facilities can be dry. So you want to take care of yourself in that manner. Also, as like a compassion thing for your patient, say they're intubated or they're in the ICU, something of that sort, and you are taking that compassion to make sure that they have the comfort of not having chapped, cracked lips. My second item is a coffee mug because we all know that healthcare providers get run down. So it's good to have caffeine to keep you going, get you up and moving in the morning, kind of give you that extra boost of energy. So Bailey, you want to introduce your items that go along with this healthcare issue?
So I have a protein bar, so you're not hungry. And when you're hungry, you might not think as clearly, and you're not as easy to work with, especially if you're like me, who gets really grumpy. And then I have water, so you can stay hydrated when it's dry, and just so you move better, and you don't get tired as easy, and all that.
Great.
Excellent.
That's a minute 30.
Oh.
Just keep going, whatever.
Okay, so for our second problem, we talked about just the preparedness and readiness that healthcare providers face on a daily basis. So I have my notebook, and just to kind of show that you have to be ready and thinking ahead whenever you're doling out tests and you're getting results, to be able to chart and just have that documentation at hand for all the providers that are taking care of the patient.
And then our second problem was taking care of the provider. Well, first I'll talk about how my PIN relates to the first problem. Sorry. So not having a PIN with you, you're not able to document. Not able to document, you're not able to give the best care you can to your patients. Very important to have a PIN and some form of documentation. Second is the problem. What?
I said, so this will, you're starting our third issue now, right?
Yes.
Correct.
Okay.
Was I saying second?
You just
Well,
keep going.
yeah,
So
just
this
Okay.
our third
The
issue.
other issue is taking care of the provider. In small things that you can do. For instance, I have a remote, and a remote, it allows you to watch TV, watch funny shows that you've been watching before, and that helps you decompress, relax, and forget about something bad that may have recently happened. And it's kind of like a reset button. It helps you reset and be able to move forward.
So I'm
Go
just
ahead.
going to clarify real quick was our third issue was to make sure you're taking out me time as a healthcare provider to rejuvenate yourself. So go ahead with yours, Leah.
Yes. So I have my shining star here, just just as a representation of just your your coworkers and your employers. Just giving out that thank you. Hey, you're doing a good job. Keep up the good work. It goes a lot for just your mental sanity to know that you're appreciated and people recognize that you're working hard.
Good job, group.
Time?
Time.
Oh,
That's all right. I don't know how we could do it any shorter.
I don't know.
You'd have to
Sorry.
talk fast. Here's the problem. Here's how you fix it.
Okay. So now it looks like we need to debrief.
Yeah,
We need to what? Oh, debrief.
debrief.
I like how we were able to give.
To be honest with you, I think that we came up with good points and like put our items into those points pretty well. Like made them have a point. You know what I mean?
Mhm.
Yeah, it wasn't just like oh, I've got this pen so I can write stuff down.
Right.
Yeah.
It was related to in the way in which we would use it in our
Right.
professions.
Right.
Yeah, like I think originally whenever I was kind of looking through this, because we really didn't have like definitive guidelines, it kind of like freaked me out there a little bit, because as our past personality analysis have showed us
Yeah.
that
Kidding.
this is what you need to do. But I think like kind of once we got to going and working that feedback from each other kind of helps you like, okay, like this is how this is going to work.
Yeah.
So, go teamwork.
Yeah.
Go team, go.
Okay, do you guys feel debriefed enough?
I think we did good.
I think so, because we kind of talked through everything like as we were going through it.
Yeah. So I know we need to talk about our group, our final thing.
Wait a second. Can we stop recording now?
Yeah, that's
Oh,
it.
yeah.
Done?
Yes.